Abstinence didn't work with sex ed. It actually didn't work because we would have been done with HIV in 1981 if we had just said, anyone who could possibly want to have sex, stop having sex.
A dark winter ahead. This is a headline that I've seen a lot lately. Medical experts as well as the media reminding us of how bad this pandemic is. But has the message been the right one? And are we starting to become addicted to the doom and gloom of reality?
Okay, vaccination's great. We're in the darkest period yet. We're getting so many mixed messages, and I and others are trying to clarify the messaging.
Many Americans are losing trust in medical professionals, the media, and government officials. Dr. Gandhi believes we have failed in our messaging. So let's take a look at the message at the beginning of the pandemic as an example.
Delivering fearful messages was very effective in this pandemic early on. Almost the entire country, with some exceptions, was more on board with a complete lockdown in March, or there was just more understanding. So using the fear and the doom and the gloom and all that messaging was very effective. We could never get to low enough values that when you start socializing again or you open up society that we don't get higher amounts. We messed it up. I'm not going to say that we didn't mess it up.
Webster describes the expression of doom and gloom as sad and tragic events, a feeling or attitude that things are only going to get worse.
Hi, Cody. How are you?
This is Lauren Mackle. She's been studying the effects of doom and gloom through the years.
People don't really look at behavioral patterns as forms of addiction. And I look at them as a form of addiction. And so pessimism, looking at life through the worst case scenario, catastrophic thinking, that can be another form of addiction.
And fear is another emotion that people can cling onto, illuminating onto the things that produce the fear. Now that is the addiction. Unfortunately, the pandemic has played well into that hand.
We are so geared, especially in this country, toward distraction. Look outside of ourselves. So you're absolutely right. Where do we go? We go to social media, we go to the news. We have habituated a pattern of focusing on the negative, focusing on, fear, not getting enough, all those things that have that impact of the gloom and doom dynamic, where we're looking at life through that lens of negativity and pessimism.
Over the years, we have been sold fear, from classic films to tragic leading headlines. It is all around us.
Fear is a very valuable commodity in in corporate America, in television, in all of those, the different outlets, because that fear and that anxiety, what are people looking to do? Well, they're looking for the magic pill, they're looking for the remedy, or again, it's like that addictive quality of it's like driving by that car accident that you don't want to look at, but you can't not look at.
Now today, after being surrounded by doom and gloom for nearly a year, many Americans are over it, right at the time that hospitals are full and the arrival of vaccines.
9 months in, two things have happened. One is that people know a lot more about this virus, and I don't mean scientists. I mean everyone knows a lot about this virus because of the work you and others have done in the media. People know that it's 20 times more likely to get it inside than outside. They know that very statistic. They know that you can't get it from surfaces anymore. That was a fear at the beginning. People know this. And so the doom and gloom and fear-mongering is met with more skepticism because people say, I totally get it. This is serious, but I'm going to stay safe within my family unit and seeing one other family, and I'm going to do that on Thanksgiving, and I'm going to ignore this. And the problem is when you ignore some of the messaging because it doesn't make sense and it's not nuanced, there's a tendency to be skeptical about the whole thing.
So as we move forward into 2021, Dr. Gandhi and other health experts are working hard to regain the public's trust by using approaches like harm reduction, more of a counseling and teaching process, very similar to that of the HIV outbreak in 1981.
So there are ways you counsel people on how to mitigate risk. It's kind of like saying exactly, abstinence didn't work with sex ed. It actually didn't work because we would have been done with HIV in 1981 if we had just said, anyone who could possibly want to have sex, stop having sex. But that's not effective messaging. People are lonely. They're not mean and awful and irresponsible and want to hurt healthcare workers. They're lonely, right? And so you message within people's parameters of their life on how to keep safe. If we did everything at 20%, that's and that keeps people safe and allows for some people to see each other, for businesses to not die, that will be more chiseled.
Dr. Gandhi said that moving forward, ventilation, mask, hand hygiene, and testing are a few ways to help decrease any risk.
So there are ways to do the lockdowns. Lockdown is not, we have to stay locked down, but ways to chisel that to allow more safety, and then vaccine, 2 vaccines, and that's how we're going to get out of this.
You know, immediately when somebody feels like you're trying to impose your will over them, they're going to resist you, even if the message is righteous, right? Just for the sake of feeling control, people will push back against it. But when you're kind, it goes such a long way, such a long way.
Hey everyone, Cody Broadway here. Thank you so much for taking the time to check out the NBCLX YouTube channel. Be sure to click here for more videos, and also click here to subscribe to join the NBCLX community.